Hello everyone, welcome back to my channel. For those who haven't subscribed yet, please do subscribe so that you will be getting updates about my future videos. In this session, we will be dealing with the blood supply of heart. And this is again a favorite topic for most of the exams. You will get umpteen number of questions as far as the blood supply of heart is concerned. So let's start the blood supply of heart. So before starting this topic, I would like to say one important point. Usually our blood vessels get filled up during systole. But this is the only place where, this means the coronary vessels. The coronary vessels are the vessels which are supplying the heart. The coronary vessels are the only vessels in the whole human body which gets filled during diastole. Okay, because what happens in diastole is there will be a column of blood in the aorta and it will be like a tank, tank filled with water. So what happens if you put an outlet for the tank, the water will flow out. Likewise, if the aorta is having a column of blood in diastole, the outlet for the aorta here are the coronaries. So they will get filled up during diastole. So coronary vessels are the only vessels in the whole human body which gets filled up during diastole. Now before we begin with the branches and their sub branches, let's see what are the aortic sinuses. So this is a cut section of the aorta. Okay, so the root of aorta. So you have three valves for the aorta. You can see the three valves. This is the anterior, this is the right posterior, and this is the left posterior. So this is the anterior, right posterior, and left posterior. So each valve will be containing a sinus. That is known as aortic sinus. So we can name it as anterior aortic sinus, right posterior aortic sinus, and left posterior aortic sinus. And from each sinus, not all the three, from anterior aortic sinus you have this is the right coronary artery. Okay, so from the anterior aortic sinus you have the right coronary artery originating, and from the left posterior aortic sinus you have the left coronary artery originating. So you have two aortic sinuses from where you have the two coronary arteries originating. So this right posterior aortic sinus is not giving rise to any of the coronary arteries. Hence, this is known as non-coronary sinus because it is not giving rise to any of the coronary arteries. So clinically speaking, this anterior aortic sinus, which we name it anatomically, is also known as right coronary sinus because it is giving rise to right coronary artery. And again, this left posterior aortic sinus, which we name anatomically, is clinically known as left coronary sinus because it is giving rise to the left coronary artery. Okay, now let's start with the right coronary artery. So right coronary artery, as we have already mentioned, it is starting from the anterior aortic sinus or the right coronary sinus clinically. And this actually descends along, so this is the right atrium, this is the right ventricle, this is the left ventricle. So this is the anterior view. Okay, so this right coronary artery is actually descending between the atrium and ventricle anteriorly. So what do you call this groove between the atrium and ventricle? This is the atrioventricular groove. So anterior atrioventricular groove. So this is descending along the atrioventricular groove, and when it reaches the inferior border, it winds back. Okay, it winds back, and these are the dotted lines. Okay, it winds back and it will be lying. So can you imagine? So this is the posterior view and this is the anterior view. So when you look at the posterior aspect, you can see that this is the right coronary artery. It winds back here and these are the dotted lines. So it is now running. This is the right atrium again. This is the right ventricle. This is the left ventricle and this is the left atrium. Okay, so it is now lying in the posterior atrioventricular groove. So these grooves you have to keep in mind because I have seen many questions asking which is the vessel lying in this groove like that. So in the anterior atrioventricular groove, you have the right coronary artery, and it winds back at the inferior border, and now it will be lying in the posterior atrioventricular groove. So this is about the right coronary artery. So when we discuss about the right coronary artery, it is easy to discuss as the first segment of right coronary artery and the second segment of right coronary artery. That is the easiest way to discuss about the branches of the right coronary artery. So what do you mean by the first segment and second segment? First segment means the part of the right coronary artery which you are seeing from the anterior aspect. So from the point of origin till the inferior border, this is considered as the first segment of the right coronary artery. And what do you mean by the second segment? It is the part of the right coronary artery which is lying on the posterior aspect. So these are the two segments of the right coronary artery. Now let's discuss about the branches of the first segment of right coronary artery. So this is the first segment. The first set of branches, we will discuss about the ventricular rami. So ventricular rami means the branches arising from the right coronary artery in order to supply the right ventricle. So we can see that the ventricular rami are actually running almost perpendicular to the main branch. And out of these anterior ventricular rami, the first branch which is supplying this is the pulmonary trunk. Okay, so this is the pulmonary trunk. So this region is known as the infundibulum of right ventricle. So the one of the ventricular rami is actually supplying this infundibulum, and this is known as right cornus artery. Okay, so the first branch, or we can say like that, of the ventricular rami which is supplying the infundibular region, this is known as the right cornus artery. And now out of the ventricular rami, one of the anterior ventricular rami is longer. Can you see this? It is actually longer, and this is actually running along the inferior border of the heart in order to reach towards the apex. So this branch is known as right marginal artery. Right marginal artery. Okay, so these are the ventricular rami. So the right cornus artery which is supplying the infundibulum. Now you have the perpendicular branches from the main trunk supplying the right ventricle. This is actually the sternocostal surface of the right ventricle. So the branches supplying the sternocostal surface of the right ventricle, and out of these ventricular rami, one is longer and it is lying along the inferior border towards the apex, and this is known as right marginal artery. At this point, I would like to say this is actually known as the acute marginal artery. Why I am specifying this is, when we discuss about left coronary, there again you will get another marginal artery. So please keep in mind, this right marginal artery is otherwise known as acute marginal artery. Now what are the atrial branches of the first segment of the right coronary artery? You can see many branches supplying the right atrium. Can you see these branches supplying the right atrium? Okay. Now the first branch or one of the atrial branches will be actually moving towards the SA node. So this is the SA node. Okay. So this is known as SA nodal artery. Okay, so this is known as the SA nodal artery. So one of the atrial branches will be winding around the superior vena cava and it will be supplying the SA node. So that is the SA nodal artery. So we have the atrial branches and the ventricular branches. So that's about the first segment. Now let's move on to the second segment. Second segment means the part of the right coronary artery which is seen from the posterior aspect. So this is the second segment. Now what are the branches arising from the second segment? We have the posterior ventricular branches. You have the right posterior. This is the right ventricle posterior aspect. So you can see the ventricular branches arising from the main trunk of the right coronary artery. Now you have one important point here. This is the posterior interventricular branch. We can see this is the main vessel which is lying in this is the posterior interventricular groove. because this groove is actually lying between the right ventricle and left ventricle. So the groove is known as posterior interventricular groove, and the artery running along this groove, you call it as posterior interventricular branch. So the posterior interventricular branch will be running along the posterior interventricular groove, and this will be supplying the adjacent sides of the left and right ventricle. Okay. Now we can see that this is not reaching up to the tip, but it is ending somewhere around 1/3. It is just ending before reaching the tip of the heart. So what happens? Why is it not extending? Because we have the left coronary artery winding and coming to anastomosis with the posterior interventricular branch. So when we discuss about the posterior interventricular branch, one of the branch, or you can say the first branch of the posterior interventricular branch, will be having a reverse will be flowing in a reverse direction. That is, it will be looping backwards into the right atrium, and it is this branch which is going to supply the AV node. So SA node is getting its supply from the right coronary in the anterior aspect, whereas the AV node is getting its supply again from the right coronary artery, but from the second segment. So second segment means the posterior interventricular branch. So the first branch of the posterior interventricular branch is having a reverse looping in order to supply the AV node. So that's about the posterior interventricular branch, and you have also posterior atrial branches. So posterior atrial branches, you can see the atrial branches here coming from the main trunk, and this will be supplying both right and left atrium. So that's about mainly the right atrium, but it will be also supplying some parts of the left atrium as well. So this is about the second segment of the right coronary artery. So the classic points which you have to remember are, it is supplying the SA node as well as the AV node. The right coronary is supplying the SA node as well as the AV node. Now let's discuss about the left coronary artery. So left coronary artery is arising from where? It is the left posterior aortic sinus, otherwise clinically known as the left coronary sinus. It is descending between the pulmonary trunk and the left auricle. Now it is a very short segment actually. The left coronary artery, when you discuss about the length of the right and left coronary artery, you can see that the right coronary from the beginning till it ends at the posterior aspect, the whole thing is known as right coronary. But left coronary, only a few centimeters from the origin, you call it as left coronary, because soon after that it is dividing into two named branches. So you are not going to call the branches as left coronary, right? So the left coronary actually extends from the point of origin till it divides into two major branches. So it is short compared to the whole length of the right coronary artery. But the caliber of the left coronary artery is larger. That is, the lumen of the left coronary is larger compared to that of the right coronary artery. So that again you have to keep in mind, because you will get some of the MCQs. The thickness of the left coronary is more compared to that of the right coronary artery. And now we will see the branches, the main branches of the left coronary. As soon as it is descending, it will be dividing into two main branches. The branch which is running along the anterior interventricular groove. We have discussed about the posterior interventricular groove, and likewise we have an anterior interventricular groove, because this is the right ventricle, this is the left ventricle from the anterior aspect. So the groove between the right and left ventricle, you call it as anterior interventricular groove. So the branch which is running along the anterior interventricular groove, you call it as anterior interventricular branch or left anterior descending. The short form which we use is LAD, left anterior descending or anterior interventricular branch. And the other branch which is lying along the anterior atrioventricular groove. This is the left atrium and this is the left ventricle, right? So this is the anterior. The anterior means the groove which you are seeing from the anterior aspect. So anterior atrioventricular groove. This is the groove. So the artery running along that groove, you call it as circumflex branch of left coronary artery. So left anterior descending and left circumflex artery, which is a branch of left coronary artery. Now let's discuss about the branches of the left anterior descending. Okay, so first one is right and left ventricular rami. Right and left ventricular rami. So if this is the anterior interventricular branch, you can see branches from this going to left as well as to the right side in both directions. So that is what is meant by right and left ventricular rami, because it will be mainly supplying the left ventricle, but it will also be supplying the adjacent sides of the right ventricle as well. So major portion it goes to the left ventricle, but some of the regions of the right ventricle which is lying closer to the anterior interventricular groove will also be supplied by the ventricular rami of the left anterior descending branch. Now what do you mean by the diagonal artery? So diagonal artery means one of the ventricular rami will be exactly taking its origin midway between the circumflex and the left anterior descending. So this larger branch, this longer branch is known as the diagonal artery because it arises like a diagonal. So if you get the diagonal artery, then you can say that the left coronary artery is trifurcating. This is the first branch, this is the second branch, and this is the third branch. It will look like the left coronary artery is trifurcating because you have the diagonal artery arising exactly at the junction of the circumflex and the left anterior descending. So this condition is known as trifurcation of the left coronary artery. Okay, now one important point which you should know is the septal branch. So what do you mean by the septal branch? Septal branch means there is an interventricular septum between the right and left ventricle. Okay, so interventricular septum is supplied by right coronary as well as left coronary artery. So if you consider this as the interventricular septum, okay, which is lying between the right and left ventricles, you just divide it into antero-superior portion. This is the antero-superior portion and this is the postero-inferior portion. Okay, this is just a schematic diagram for you to understand. If you keep this piece here, this is the antero-superior and this is the postero-inferior. So this septal rami of the left anterior descending, can you see the dotted branches coming from the left anterior descending? So these are the dotted branches. So these are the septal rami which is passing through the interventricular septum, and this will be supplying the antero-superior ventral two-third or the antero-superior portion of the interventricular septum. So the antero-superior or the ventral two-third is supplied by the left anterior descending, the septal rami of the left anterior descending. So what about the postero-inferior portion of the interventricular septum? That is from the posterior interventricular branch. So you can see the posterior interventricular branch running along the posterior interventricular groove, and from here you can see the dotted branches. Can you see the dotted branches? So this is the septal rami arising from the posterior interventricular branch of the right coronary artery. Okay, so the posterior inferior aspect of the interventricular septum is supplied by the right coronary artery. Okay, so that is how the interventricular septum is supplied. So anterior two-third by the septal rami of the left anterior descending. So in a way it is the left coronary, and postero-inferior is supplied by the septal rami of posterior interventricular branch, which is a branch of right coronary. So this is seen in most of the population. Now we will move on to the circumflex branch. Okay, circumflex branch of the left coronary artery. So what are the branches? So this is the circumflex branch. You have the atrial and ventricular rami. So the circumflex branch will be supplying the atrium as well as the ventricle. So that is what is meant by atrial and ventricular branches. So from the anterior aspect and from the posterior aspect, you can see the left coronary supplying the left atrium and left ventricle mainly. That is the importance. Now, what are the other branches? SA nodal artery. So, in majority of the population, SA nodal artery comes from the right coronary, but sometimes, say 30% of people will be having the SA nodal artery coming from the left coronary artery. What is the next one? Next one is the left marginal artery. Left marginal, we have mentioned about the right marginal artery arising from the first segment of the right coronary artery, which is running along the inferior border. Likewise, you have the left marginal artery arising from the left circumflex and which is running along the left border of the heart. Okay, so this is the left marginal artery, or this is a left marginal, or otherwise it is known as obtuse marginal artery. Okay, you have to keep this point in mind. This is called obtuse marginal, whereas the marginal artery of the right coronary is known as acute marginal. Okay, and this left marginal artery is actually made use during bypass graft. So if you have an occlusion somewhere here in the circumflex, what they usually do is they will keep a bypass graft from the aorta onto the marginal artery. So this is usually made use for bypass grafts. And what is the next option? Sometimes you might get the posterior interventricular branch coming from the left coronary artery. So the right coronary won't be giving the posterior interventricular branch. Instead, the left coronary will go like this and will be lying in the posterior interventricular group. So that is one option. In majority of population, the posterior interventricular branch is coming from the right coronary, but some cases you can expect the posterior interventricular branch coming from the left coronary. At this point, I would like to discuss one important point. Have you heard about coronary dominance? Coronary dominance. This is again a very favorite questions for the examiners. Coronary dominance means it is actually decided by looking upon one single artery. So which is the artery? It is the posterior interventricular artery. So if it is coming from the right coronary artery, you call it as right dominance. You say that that person is having right dominance. Suppose if this posterior interventricular branch is coming from the left coronary artery, what will you say? Then we say that that person is having left coronary dominance. Suppose imagine you have posterior interventricular branches coming from both coronaries, both right and left. What do you call that condition? That condition is known as codominance, and that is said to be a balanced type. That means you have the posterior interventricular branch coming from both right and left. So at this juncture, I would like to ask which is most dangerous, whether it is right, whether it is left, or codominance. What will happen in right coronary dominance? Right coronary dominance is the branches which we have discussed right now. So in right coronary dominance, if you just have a look at the interventricular septum, what will happen? The anterior 2/3 will be coming from the left coronary. Posterior inferior aspect will be supplied by the right coronary, because the posterior interventricular branch is a branch of right coronary in right coronary dominance. What will happen in left coronary dominance? In that case, anterior 2/3 will be supplied by the left coronary. The posterior interventricular branch in left coronary dominance is coming from which artery? Left coronary. So posterior inferior aspect of the interventricular septum will also be supplied by left coronary. That means in left coronary dominance, the entire interventricular septum will be ultimately supplied by the left coronary artery. So suppose you imagine, if you just get a block in the left coronary artery, what will happen? The entire interventricular septum will suffer. So that is why we say that left coronary dominance is more dangerous compared to the right coronary dominance. And what about codominance? Codominance is always safe because you have the branches from both right and left supplying the interventricular septum, and you have the two posterior interventricular branches in codominance. Okay, so that is said to be the safest. Now about the anastomosis happening in the in the coronary vessels, usually we say that functionally there are no anastomosis, though we say anatomically there are anastomotic network, functionally they are said to be end arteries. But when we go to the deeper aspects of the anastomosis, there is still anastomosis happening at the precapillary level. So we are not going into the details of all those things, but for the time being, we say that there are some named anastomotic networks, anatomically speaking, but functionally we usually say that the coronary arteries are said to be end arteries. So which are the named anastomotic networks? We have mentioned about the right conus artery, isn't it? From the right coronary artery. Similarly, you have one conus artery arising from the left coronary artery as well. It can arise either from the left anterior descending or left circumflex artery. And both these arteries will be supplying the infundibulum, and they will be actually anastomosing in front of the infundibulum, and it just looks like a necklace, isn't it? Hence, this anastomotic necklace is known as annulus of Vieussens, 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 annulus of Vieussens. Okay, so this anastomotic network is known as annulus of Vieussens. Now, second anastomosis, the famous anastomosis happens here in the interventricular septum. You have the septal rami coming from the left anterior descending and the posterior interventricular branch. They will be anastomosing in the interventricular septum. So this is again a site of anastomotic network. Now at the posterior aspect, what do you mean by crus of heart? Crus of heart means this is the point where the interatrial groove, interventricular groove and the atrioventricular grooves meet. Okay, that is what is meant by crus of heart. Interatrial, interventricular and the atrioventricular groove. So if you look from the posterior aspect, you can see that the right coronary artery will cross this crus and will go and anastomose with the left coronary artery. So just left to the crus of heart, the right coronary and left coronary arteries will be in most of the cases anastomosing. That is again one of the anastomotic point. Sometimes this won't cross the crus and it might end at the inferior border, or sometimes it will end here. If it is crossing the crus, it will go and anastomose with the left coronary. Left coronary means it is a circumflex branch of left coronary, just left to the crus of heart. That is again another anastomotic point. Then one more thing, that is, we have mentioned about the atrial branches of the circumflex, right? So one of the atrial branches, you imagine this is one of the atrial branches of the left circumflex, will be anastomosing with one of the atrial branches of the right coronary. Okay, so this branch which is anastomosing with the right coronary artery, atrial branch of the right coronary artery, this branch of the left circumflex is known as Kugel's artery. So what do you mean by Kugel's artery? It is the atrial branch of left circumflex artery which is anastomosing with the atrial branch of right coronary artery. That is what is meant by Kugel's artery. So all these can be asked as MCQs. That is why I am stressing it again and again. Now, so we have discussed about the trifurcation of the coronary artery. Have you heard about third coronary? We have mentioned about right coronary, left coronary. So that is what is meant by two coronaries. Have you heard about third coronary? Sometimes this right conus artery, we have mentioned about the right conus artery, instead of arising from the right coronary, it will straight away arise from the anterior aortic sinus. Okay, so if this is arising directly from the aortic sinus, you call it as third coronary. So the right conus artery sometimes instead of arising from the right coronary artery will directly arise from the aortic sinus. In that case you call it as third coronary. Now sometimes this left coronary, instead of arising from the left posterior aortic sinus, it will take its origin from the pulmonary trunk. What will happen in that case? If it is arising from the pulmonary trunk, the entire left coronary artery will be filled with venous blood and that will result in left ventricular failure. So that is one option. Another option is this left coronary artery, instead of arising from the left posterior aortic sinus, will arise from the anterior aortic sinus. Just imagine This will be arising from the anterior aortic sinus. So this will be having a longer course compared to the normal one. So if you just imagine here, this will be arising from the anterior aortic sinus. So this left coronary will be lying between, this is the aorta and this is the pulmonary trunk. So this left coronary artery will be trapped between the pulmonary trunk and the aorta. You can see the pulmonary trunk here and you can see the aorta. So this left coronary artery, which is having a longer course, will be trapped between the aorta and pulmonary trunk. So what will happen? There will be sudden occlusion of the left coronary artery, and that is the one of the reasons of sudden cardiac death happening. Now one theoretical analysis is, as we age, there are more number of collateral anastomotic networks formed around the heart. So in that case, we can say that the elderly people who gets myocardial infarction, if they are not having any comorbid conditions, are having a better chance of survival compared to younger people, because as we age, it is said that there are more number of collateral anastomotic networks happening. Now, one more important thing which I would like to mention is, this left circumflex is actually running closer to the mitral valve, mitral annulus. So, in case of mitral replacement surgeries, this left circumflex can easily get damaged. So, that is one of the applied aspects of the left circumflex. And now usually for bypass grafts we use the great saphenous vein, but when we keep the great saphenous vein as you have taken from the lower limb, what will happen? It will be having valves, so there won't be blood flow down. So you have to reverse the direction of the great saphenous vein when you are keeping great saphenous vein as a graft for the bypass surgeries. And nowadays we have stents, we have ballooning, many advanced versions of treatments are available. I am not going into the details. So this is about the blood supply of heart and the applied aspects in a nutshell. Now I would like to discuss some of the questions which are asked frequently for all the entrance exams. Let's see some of the questions which have been constantly asked. So before moving on to the questions, I would like to add one more point, that's about the thrombus, occlusion of the coronary vessels. The first or the most commonest vessel to be occluded is the left anterior descending, which is a branch of left coronary artery. So since myocardial infarction from left anterior descending branch usually result in death of the males, which are commonly affected, this left anterior descending artery is also known as widow's artery. Okay, so that point you can keep in mind. Then after the left anterior descending, the next commonest artery prone for occlusion is the right coronary artery. It can be the proximal 1/3 or it can be the distal 1/3. So this is the right coronary artery in the second position, and the third position you have the left circumflex branch of the left coronary artery. So these are the three major vessels which are more prone for occlusion, and the marginal vessels are always on the safer side. Now about the nutrition of the heart, we have seen that all the blood vessels are supplying the outer aspect of the heart and especially the myocardium. The endocardium of the heart, the endothelial surface of the heart will be getting its nutrition from the blood which is in the chambers. We have blood in all the four chambers, right? So that will be providing nutrition for the endothelial surface or the endocardial surface. The remaining, the myocardium, the main supply of the heart, that is the myocardium, will be coming from the coronary vessels. And we can conclude the blood supply of the right and left coronary like the right coronary will be supplying the entire right atrium. Why I have mentioned like this is, when you talk about left coronary, we will see the difference. Okay, so the right coronary will be supplying the entire right atrium, most of the right ventricle, SA node, AV node, and also the postero-inferior aspect of the interventricular septum. That is how we conclude the blood supply of the right coronary artery. What about the left coronary artery? Left coronary artery supplies most of the left atrium. We cannot say that the entire left atrium, because the left atrium is receiving some of the branches from the right coronary as well. So right coronary supplies the entire right atrium, but left coronary supplies most of the left atrium, most of the left ventricle, and the ventral two-thirds of the interventricular septum. That is how we conclude about the right coronary and left coronary artery. Now we will move on to the questions. The first question: occlusion of the left anterior descending artery will lead to infarction of which area? We have seen the options: posterior part of interventricular septum, anterior wall of the left ventricle, lateral part of the heart, inferior surface of the right ventricle. So which part? Left anterior descending. It is the anterior wall of the left ventricle. Next question: right coronary artery supplies all of the following parts of the conducting system of the heart. So the conducting system of the heart, we can say that it starts from the SA node, then to the AV node, then to the bundle of His, then it divides into right and left bundle branches, then finally the Purkinje fibrils, isn't it? So that is what is meant by the conducting system. So the SA node and AV node, definitely you know it is the right coronary artery. Then AV bundle, again you have the left coronary and the right coronary artery, but the right bundle branch is exclusively supplied by the left coronary artery. You might be mistaken for the right in the right bundle branch, because the right bundle branch and the left bundle branch, which are there in the interventricular septum, are mainly supplied by the left coronary artery. So among the all four options, right coronary artery supplies all except the right bundle branch. You have to keep that point in mind. All of the following arteries are common sites of occlusion by a thrombus, except, I have mentioned it, the anterior interventricular branch is the most commonest branch. Then you have the right coronary, which is not given here. Then we have the circumflex artery in the third position. It is given here. Then posterior interventricular branch again are prone for blocks, but marginal artery is the least common site for occlusion. Now, coronary dominance is determined by. So, coronary dominance is determined by looking at the posterior interventricular artery. If it is from the right coronary, you call it as right coronary dominance. If it is from the left, you call it as left coronary dominance. And if you get branches from both, you call it as codominance. The next question: posterior interventricular artery is a branch of right coronary artery in most of the people, that is in right dominance. In 10% of the population, it arises from, we say it as left coronary, but we know that the left coronary artery is a very small segment, because it divides soon into left circumflex and left anterior descending. So if you have the circumflex artery in option, it is the circumflex artery which is giving which is giving rise to the posterior interventricular branch. So more nearer option you have to go for. So it is the circumflex artery. Okay, so left coronary artery we say, because circumflex artery is a branch of left coronary, but if you have the circumflex artery in the option, you have to go for that. Then arterial supply of ventral two-thirds of the interventricular septum. It's the most straight question, right? So if you have the left anterior descending artery, you have to go for that, but it is not given here. But instead, we are having left coronary artery, because left anterior descending artery is a branch of left coronary artery. Then you have to go for that answer. True statement about right coronary artery is or are. You might get multiple options, that is why it is given like that. Diameter less than the left coronary artery. We have mentioned that left coronary artery is thicker, because left ventricle is more muscular compared to right ventricle, right? So you have the left coronary artery which is having a larger caliber. It is right. Right coronary artery arises from the anterior aortic sinus. Yes, it is true. Right coronary artery supplies major portion of the right atrium and ventricle. Again, it's true. Right coronary artery gives rise to circumflex coronary branch. No, it is from the left coronary. Right coronary artery supplies right bundle branch. We have already seen a question. It is by the left coronary. The right bundle branch is supplied by the left coronary. So, A, B and C are correct. Now the next question. Which is true about the atrioventricular groove? Or among the options, all are true about the atrioventricular groove except. So atrioventricular groove means the groove between the atrium and the ventricle. It contains the left anterior descending coronary artery. Is it like that? Left anterior descending is lying in the anterior interventricular groove. Okay, so it is not lying in the atrioventricular groove. It is also known as coronary sulcus. Yes, mainly in the posterior aspect where you get the coronary sinus lodged, you call it as coronary sulcus. It contains right coronary artery. Yes, the first and second segment of the right coronary artery is lying in the atrioventricular groove. It contains circumflex branch of left coronary. Again, circumflex branch is lying in the anterior atrioventricular groove and the posterior atrioventricular groove. So the option, the odd one out is it contains a left anterior descending. It is not containing the left anterior descending. The next question, if the circumflex artery gives off the posterior interventricular artery, then the arterial supply is called. Again a straight question. A circumflex is a branch of left coronary, so you call it as left dominance. Next question, branch of right coronary artery is or are. Is or are means you might get more than one option. Obtuse marginal is a branch of, what is it a branch of? Obtuse marginal is a branch of circumflex. So it is not a branch of right coronary. Acute marginal, yes. So right marginal artery is otherwise known as acute marginal, which is a branch of right coronary. Posterior interventricular, yes. In most of the cases, posterior interventricular is arising from right coronary. Diagonal, no. Diagonal is actually the ventricular rami of the left anterior descending, which is arising at the junction of the circumflex and left anterior descending. So it is a branch of left coronary. It is not a branch of right coronary. Conus artery you can get from the right as well as from the left. So it can be a branch of right coronary artery as well. So B, C and E are the options. So that's about the blood supply of heart. Hope you have understood. Leave your comments if you have understood the session nicely. And thanks a lot for watching. Thank you.